Hey guys, welcome to another question of the day. Today's question is, does fat transfer for breast enhancement work? All right, here we go. Loaded question because there's lots of anatomical considerations here in order to properly answer the question. When you come to see me for consultation and you're thinking potentially about not having implants at all and maybe having fat transfer in order to enhance the breast, is that possible? Absolutely. But we have to look at specific things, and you need to know a few things before I can really properly answer whether that's right for you or not. Who is not a good candidate to have fat for augmentation? First, you need to realize that usually in your mind what you're thinking is that we can transfer fat to the breast that would be equivalent to placing a breast implant, and that is not true. We cannot put large volumes of fat into the breast in any one sitting that would increase you 2 or 3 cup sizes because the fat won't live. The fat needs good blood supply in order to live, and if we just inject a big old blob of fat into your breast, the center of all of that fat mass is not going to be able to revascularize or get blood supply in order for those cells to live. Rather, we need to spread fat broadly into the breast to layer it out and increase the surface area that's exposed to blood supply in order to get fat to live. Being that said, if you come in and you have loose quality skin and not really good breast tissue quality, you're probably not a great candidate for large volume fat transfer. It's not gonna automatically lift your breast and give you the shape that you're thinking. So in your case, what you may need is a breast lift where we tighten up the skin envelope and breast tissue, and then we put some fat into the breast to give you some size and some shape. If a patient comes into me who actually has tight quality skin and is a smaller breast with no sagging at all, that is a better candidate for fat transfer. Now again, the same rule applies. We can't just infiltrate 2, 3, 4, 500 cc's of fat into the breast and expect it to live. In fact, what can happen is not only does most of the fat die, but you get something that's called fat necrosis. And fat necrosis is when a blob of the fat cells that don't live form a hard nodule in the breast that feels really firm. Again, thus the reason why we need to put micro droplets of fat into the breast at one time and spread it out broadly. So in the patient who has a tighter skin envelope with no drooping or sagging of the breast, we may be able to put 100 or more cc's into that breast, get a little bit of volume expansion, and then bring you back in another procedure and do it again. So for most patients who are looking for a larger change in volume of their breast with just fat transfer alone, you're gonna be marrying yourself to several fat transfer procedures in multiple operations, and it's doable, but it's slow over time. It's a great question. I'm glad you asked that question because in this day and age where we're doing a lot of explantations, I get a lot of patients asking me to do fat transfer at the same time, and this is kind of the discussion that we go through, is the quality of their tissue and are they a good candidate now for it, or should we do the lift and do it later? So that's a great question and I appreciate you asking it. Again, you guys asked the question and I will answer it. Have a great day.